I am working with high-risk patients, so anybody who is frequently in and out of the ED, things like transportation, housing, utility assistance, if they have children in the house, childcare. I've personally seen with a few of my clients instances where the numbers have dropped severely from 15 to upwards of 20 ED visits to maybe 1, 2, or 3, perhaps even 0.
It was about as low as you could be. My emotions were in the gutter.
He had recently lost his leg due to an amputation related to his diabetes complication.
Brian was able to point me in all the right directions and who to talk to. And he even made phone calls for me, trying to make sure that he could discuss my case, so I put him on my forms so he could discuss my case with my insurance.
But now he also has his prosthesis, and so he's beginning to learn how to walk again.
I had talked to my primary care doctor, who is part of the Griffin Physicians.
She doesn't have enough to really provide for herself and her daughter as far as food goes.
Wasn't sure what to do or where to go.
So I was able to link her to Spooner House, the food bank out there.
Assistance programs for my daughter that he introduced me to, and things right now have gotten better. They're not quite there. I'm still working on a lot of different things, but I know eventually it'll get there. I just need to kind of give it some time and some effort.
Where it's not just about a list of symptoms. It's not just about how can we make sure this patient's taking their medication, but more so, how do we ensure that this person is living a healthy life outside of just healthcare?
I am excited for the future, and even working with Brian and Dr. Arbia, they're just making my life easier to manage.